Hi friends, today we are going to discuss about stress. I am Dr. Suresh Padadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Services at NIMANS, Bangalore. Today we will be discussing about what is stress, understanding about stress, do we require stress, and stress among healthcare professionals. Before we start discussing about stress, let's discuss about burnout. The concept of burnout was brought by Herbert. According to Herbert, it is an ongoing job stress. It's a chronic stress without any resolution. So, in COVID crisis, this COVID is not seems to be ending. That means there is a classical burnout available. Along with this, usually burnout are secondary victims. However, in COVID crisis, the doctor, nurse, healthcare professionals, they are both primary and the secondary survivors. Secondary survivors basically providing care to the primary survivors. But there is a possibility they can also get infected. So they become both primary and secondary survivors, and the burnout is very high because the chronic stress is building up over a period of time. Now let's discuss about stress. The person who discussed about stress for the first time is Huxley. According to Huxley, it is a non-specific response of the body to any demand. He also called it as general adaptation syndrome. But however, the Lazarus changed the definition. He said that it is not the event which is going to determine stress. It is the perception of an event which determines the stress. That is, if there is an event like maybe earthquake, that's not going to determine the stress. It's basically how we perceive the earthquake determines the stress. That is how Richard Lazarus said. There are many definitions on stress, but not even a single acceptable definition which is available. For understanding, for this video, we will consider stress has two important factors. Suppose we consider body, and inside the body we will call it as a internal environment. Like inside the body, physical health, mental health, genetic vulnerability, thinking, substance abuse, lifestyle, infection. So these factors forms the internal environment, that is environment within the body. However, there are certain factors which we call it as external environment. They are disaster, job related stress, family related stress, financial problems, fame, death, loss of relationship, riots. These all form the external environment. So if there is a demand either from the internal environment or from the external environment, can cause severe stress. For example, in physical health, if it is a diabetes, maybe cancer or hypertension, stroke can cause internal environment homeostasis disturbance. Similarly, if there is a severe anxiety, depression, various mental health issues can also create increased stress. Genetic vulnerability. Family members having one or the other illness which can be transmitted to the person can also increases the stress. The way we think as per the event, like Lazarus has said, that also induces stress. So with this we move is, do we require stress? If you look at this, if you look at the intensity of stress on the x-axis and performance on the y-axis, as the stress increases, the performance also increases. But however, increase in the stress further decreases the performance. That is called as distress. The distress is the point where performance decreases and the health issue starts picking up. For example, workplace stress. Can we discuss about this? Of course, this is very essential during the COVID crisis. The common cause of stress, especially in COVID, are fear of contracting COVID infection, fear of dying alone. If I get infected and are isolated, and then if I die, no rituals, what will happen? I don't know. This fear of dying alone is a big threat. Fear of transmitting infection to the family members, friends, colleagues. That's a guilt, a huge guilt which a doctor carries or a nurse carries, because we have been trained to provide care, not to infect. So this moral guilt is going to cause more problem to the healthcare professionals. Fear of losing loved ones, because the COVID does not attack one person, it attacks the whole family. So that's a very, very important point we should remember. Stigma, discrimination from society, non availability of protective gears, and safe place after the work hours is a very important point, which that is going to determine stress. At the same time, do we have plan? Do we have support if there is a quarantine or isolation of the healthcare worker? And what is going to happen to the family members? The plan should be very clear. If the plan is very well laid out, any healthcare professional would love to go and work. At the same time, further important points are inadequate training. If you don't know how to wear PPE, that is basically protective gears, of course you will be stressed out. The guidelines are changing very fast. You have to update yourself with the guidelines. At the same time, accurate information of COVID is not available because it's a novel virus. We are slowly learning. So this non-availability of accurate information, media creating a hype, social media creating ruckus, this is going to cause more stress. At the same time, communication at workplace do play a major role. Workload, of course, if a person, if a doctors of an unit get infected along with the nurses and they go for quarantine or isolation, the remaining healthcare professionals need to provide care. That workload is going to cause an immense pressure on the healthcare professional. Managing the emotions of the COVID patients, because if you are isolating a patient, invariably he will have various emotional reaction. It may be depression, attempting suicide, crying, irritability, anger. So dealing with these emotions of a human is going to drain out the energy of a healthcare professionals. Violence by patients, family members is an added stress. Along with pre-existing health issues of the healthcare professionals is a one more worrying thing. Along with this, traveling to workplace, if it is a long distance, is going to add to stress. At the home front, the healthcare professional also need to deal with the supporting, how to support the family members during the working period, who is going to provide day-to-day related issues at the home front. Imagine if I'm working and if my family requires something, who is going to provide them? Who will take care of my family if something happens to me? If I die, who is going to take care of my children? That's a big question which every healthcare professional do ask. Plan for family members for treatment if they are also infected. Imagine if I'm infected and if my family members are infected, do we have a plan? Do our hospital or our community, do they provide any support? Managing children during this lockdown is a big challenge many families are facing. Cost of treatment and hospitalization of the family members is also a big challenge. Finally, is there a plan? Have you planned? If you're a healthcare professional, don't think you're not going to be infected. Definitely one or the other day you're going to be infected. Do you have a plan? If you have a plan, the stress will be less. If you don't have a plan, when it strikes, it will strike to the whole family, not for only for you. So you have to prepare yourself in advance. Please remember, stress is inevitable part of our life. Thank you for giving your time. Please do subscribe to my channel, any of this, either Facebook, Instagram, or YouTube. Stay safe.